The doctor ordered a tracheostomy dressing change and sectioning. First, I'm going to gather and prepare the supply. We had a suction kit, we had um, dressing kit, and we had normal solution, we had clean glove, we had resuscitation bag, and I had a mask on and facial. I would check the isolation precaution before entering patient's room and perform hand hygiene and provide privacy. Good afternoon, Mr. Johnson. My name is Ife. I'm your nurse today, and your doctor ordered your tracheostomy suction and the dressing change. Do you have any questions? May I verify your first name and birthday? I'll perform hand hygiene and put on the glove. First, I'm going to check the suction, make sure it's connected to the equipment with a setting at about 80 to 120. And next, I will check the oxygen and the humidifier, make sure it's connected directly and setting as a provider order. Then I'll check the emergency equipment at the bedside. Ensure the patient's in a fuller or semi-fuller position. I'm going to hyperoxygenate the patient for 15 seconds, then change to the previous setting. Put the aversion pad on the patient's chest. And I'm going to turn on the suction and adjust to about 80, 100 to 120 mmHg. Then I'm going to open the normal setting solution and open the suction kit. Unfold the container, make sure I'm not touching the inside. And put the saline in the container. Okay. Then I'm going to remove the glove. Perform hand hygiene. I'm going to open the sterile glove. This is the suction tube in the right hand. Then I'm going to connect the tube, the end to the suction equipment. Then I'm going to remove the patient the oxygen mask with my left hand. And the right hand sterile, I'm going to hold the catheter and dip into the normal saline. Just check the suctioning. It's working. And I'm going to insert. Ms. Johnson, can you cough for a couple times? Then I'm going to slowly remove and withdraw. And with a rotate motion. Then at the same time, I'm applying the suction. Now I'm going to disconnect the suction. Then discard the catheter in the biohazard bag. Discard the supply. remove the glove, perform hand hygiene, and document an HR. Now I'm going to perform the tracheostomy dressing change, and I'll perform hand hygiene. And put on the glove. First, I'm going to remove the old dressing, stomach dressing, and discard in biohazard bag. Remove glove, perform hand hygiene. Okay, I'm going to open the dressing kit. Pick up the spherical and put it aside. Shiny side down. Okay, good. Put the saline into the chamber. Now I'm going to put on the sterile glove. Then I rearrange the supply. Okay. And first I'm going to take out the inner cannula. Soak it in the saline. Then I'll use the brush to clean inside and the outside. Then rinse it in the normal saline. Then going to dry the inside. And the outside. And I can insert. Once the insert cannula is clean, then I'll insert it into the outer cannula. Okay, I'm going to dip the Q-tip to clean underneath. Then I'm going to clean the surface. Motion circle in from inside to outward. Now I'm going to dry the underneath. And the surface. Now I'm going to put the new dressing on it. Okay. Then I'm going to change the wrap around. Okay. Make sure it's secure. Hold it tight in place. Okay, and I'll remove the old dressing, the old tie. And put an oxygen mask back on the patient and adjust the oxygen level to the previous setting. Then I'm going to discard the supply. Remove slugger glove. Perform hand hygiene and document in EHR.